Everybody, I'm Katie, and I am presenting another one of Beta Change's Minisodes. With me today is a very special guest, Lisa Hynes, and we're going to talk about something that really contributes to life with a chronic condition, and that is our mental health and psychology. So psychology and diabetes is our topic, and I've got the great researcher Lisa here, and she's going to introduce herself. Again, my name's Katie. I'm coming to you from New York, and we are live on Beta Change. So Lisa, take it away.
Thank you, Katie. Yes, my name is Lisa Hynes. I just want to say huge thanks to Katie and to the Beta Change team for giving me the opportunity to contribute this evening and to chat about what it's like specifically as a researcher, mainly working with young adults with type 1 diabetes. I'm from Galway in the west of Ireland, a city on the west coast. And that's where I did a master's in health psychology and a PhD in health psychology, but I'm currently based in West Virginia, at West Virginia University. I work as a postdoc researcher here, working with the pediatric lab for adherence and transition research, mainly with young people with asthma, but I'm still involved in type 1 diabetes research as well. Yeah.
And how are you liking it here in the US so far?
Very much. I arrived just at the end of August last year, so I'm here for a 2-year adventure and very, very much enjoying the opportunity to be in the States and to see all of the amazing and very different and very random things that the place has to offer. Some beautiful weather. West Virginia is an extremely beautiful and very fun place to be, so I'm very happy.
Well, I'm glad you're liking it. That's great. So, Lisa, let's kind of start off with a little bit about the field of psychology, in particular with chronic conditions and diabetes. Can you talk maybe a little bit about what the research environment is like and why it's important for the diabetes community to support research initiatives, and kind of give us a general overview about
that? Absolutely. So, as you started off by introducing Katie, mental health and well-being, the whole area of psychology is extremely important for people living with long-term conditions. There is an awful lot of things that people with a long-term condition need to deal with and face and go through so many phases from the experience of being diagnosed with the condition all the way through to kind of getting used to things and having to deal with other things in their lives as well as whatever the condition is that they're living with and so on. So psychology has a really big role to play. People often don't think of psychology when they think of kind of more physical health, but our physical and our mental health are completely, tied together. So to have kind of your maximum physical health, your mental health and how you take care of yourself, how you understand your health, how you understand health problems and your role in kind of managing your health just plays a huge role in a person's experience of something like diabetes, for example. There's a huge area of research out there to do with diabetes. I'm a health psychologist, mainly working in research, and what health psychology is a kind of area of psychology that has to do with how people understand their health or illness and what people do to take care of their health or to take care of themselves if they're having a health problem. We're also very interested in health services and how they work or maybe how they don't work, and trying to influence things to help people to change, to help people to meet their goals, to understand maybe what's going on for them if they're really struggling with their health or really struggling with taking care of their health, and want to make a change in whatever way. And that can be for everything in relation to health, diabetes or any health related issue. But diabetes is extremely complex, as you guys all know very well. And as I said, there's a huge amount of research out there, a lot of stuff trying to understand how it impacts people to have diabetes, how it impacts people at different times in their lives, how it can be easier or more difficult to live with a chronic health condition like diabetes. And so there's lots of programs out there trying to improve things, and it can be more or less successful in research, but that kind of speaks to the question that you had there in terms of why it's important to do this research, and why it's important for the diabetes community to be involved in the research. And we might get onto it as we're talking, but the involvement of the diabetes community is very much a part of the research that I've been involved in, and it's completely essential for us to make sure that we're asking and answering the right questions.
Yeah, and I think that segues perfectly why supporting research is important into how we met. So I was on Facebook one day. I was living in New Zealand, and I am scrolling through Facebook, and I see that one of my friends, who also has type 1 diabetes, posted about a survey that I should take, or she was, advertising it to her friends on Facebook. So I took the survey, and it was an NUI Galway survey, and it was about experiences in diabetes clinics from the perspective of young adults. And after I took the survey, I had to look up who developed it, because I was so impressed with the depth of the questions and how they really were trying to reach everyone that was taking it. And I just couldn't believe that a simple, scientific multiple choice form could really affect how I was thinking about my own experiences. And it made me reflect on experiences that I'd had in the past. And also it's really helped me to look at my future experiences in diabetes clinics in a better light. So I reached out to you, Lisa, and I really wanted to learn more about the study that you were working on that kind of led to the development of this survey and the research that you were doing. And I've since written a couple articles about you that have been featured on the AD blog and on Beyond Type 1. And now you're on Beta Change doing Minisode with us. So we're so excited to really talk about this area and how it can impact people. And I think a chance encounter to be able to share some of your own experiences is really powerful. And you kind of give that tool to your participants. So can you talk a little bit about that and maybe how it kind of is empowering to the diabetes community?
Absolutely, and thank you for sharing that story, Katie. It was really amazing. I remember receiving that first email from you, and other young people who took part in this study also reached out at the time, which was a really amazing experience. Sometimes doing research can feel very far away from the people that you're interested in and the people that you're trying to connect with. But so the study that you're talking about was the third study in my PhD research, which focused on the experience of young adults in adult diabetes clinics, why that sometimes is a pretty difficult time and a difficult place for young adults to be. And often young adults spend a lot of years in their kind of late teens and early 20s not engaging with a diabetes clinic at all, which can mean that there's a gap there in the support that they have to manage their diabetes during that really challenging and busy and unpredictable time of young adulthood. So my aim was to understand what was going on during that time. Why was the adult diabetes clinic not always a good place for young adults? Why were they not always attending, or there was long gaps in between visits to their adult clinic? And so I started off by doing an interview study to find out more about what was going on, a very open kind of a study where I interviewed young people with type 1 diabetes and service providers who work with young people to find out what's going on in adult clinics and in pediatric clinics that might be kind of contributing to the issues. And so the questionnaire then that came out of that was full of questions that come from tools that already exist to help researchers to understand more about people's experiences. But I think it spoke to you and to others because each of the tools in it came from the information that came from that interview study. Mm-hmm. So it was put together because people with diabetes and service providers working with people with diabetes told me that those were the important things when it came to their diabetes clinic. And the idea there was that it would point us in a particular direction for future research that is still ongoing now, in terms of changing the way that service providers work with young adults with type 1 diabetes, because the old way wasn't working that well. And so I think that's an example, I suppose, and it was very influential for me as an experience as a health psychology researcher of why it's so important to take the lead from the people that you're researching, to kind of to guide the direction of research. And that's something that happens a lot these days in health research. We have to call it public patient involvement research, or PPI. And that's the really, exploding field at the moment of proper engagement between different communities. For example, the diabetes community, research and policy development, and health services design, and health service providers themselves as well.
Yeah, and I think that about from someone who is affected by your research and using them is really an interesting concept. Is that something, so you said it's becoming more common, but is that something you're seeing in other fields, in asthma, for example, or, where you're studying other chronic conditions?
That's a good question. So it's something that I've come across to a certain extent in the US, but I suppose I'm just not as familiar with it as I have become in the Irish context. So in the Irish context, it in quite a short period of time has gone from being something that people knew was a good idea, and we were recommended to use this PPI, or a stakeholder-led approach, but we weren't sure really what that looked like or why exactly it should be done, in what way it was going to benefit everyone involved. And now there's really a very strong backing to it. There's far more guidelines, and it's pretty essential really these in recent times in health research to have that kind of stakeholder collaboration. And it's something that is a part of what we now call the D1 Now study, which is the diabetes research that I was
going to ask you about that. I think that's a perfect example. I really think that the Strength in Numbers conference and the hackathon and the entire young adult panel is something that is a terrific example of that, of patient-guided research. So could you tell us a little bit about that, Lisa, and what running that experience is like?
Absolutely. So kind of parallel to when I was doing my PhD research, and the reason why I started that research was because when I suppose became interested in doing a PhD, I was very interested in what we call transition, the period of transition for young people with chronic health conditions. And that is the whole time around late adolescence, young adulthood, when just absolutely everything is changing, and it's a really difficult time in general, but particularly when you're living with a long-term condition. And when we approached one of the local healthcare providers, Professor Sean Deneen, straight away he said, young adults, clinic attendance, we need to know what's going on, we need to start doing things differently. So I started my research within a team that was already extremely engaged and determined to figure out what's going on and do stuff differently. So as I was doing my PhD research parallel to that, the team that I was working with, which was a diabetes clinic, a clinical service provision and research kind of team, were also starting off on a path to do ongoing young adults work. So during my PhD, I was also involved in that work, which aimed to really start from the ground up to understand what was going on in terms of self-management for young adults, what made it easier, what made it more difficult for young adults to take care of their type 1 diabetes, and how could we think of a different way, come up with a different and more effective way to work with young adults. And we were open to changing things completely, a completely different service, maybe not in a hospital at all. Whatever came out, we were going to explore. So one of the first things that we did, and this was very much prompted by experiences of the research team in previous studies, was straight away to get young adults engaged and involved in a very meaningful way as part of the study. So we engaged with a youth mental health organisation called Jigsaw Galway, who have for many years have been guided by young adults very much a part of their management structure. And so we were completely, taken and inspired by this approach of meaningful engagement. So we didn't just want to just ask young adults. We wanted them to be properly engaged and part of the research team. So through a kind of a process of reaching out to the young adult community across Ireland, inviting them to a consultation event, engaging in an interview process where there was a lot of communication about what exactly we were talking about, what would be involved, so that it was very much about mutual understanding and getting everything out there and clear. And a panel of 8 young people aged between 18 and 25 with type 1 diabetes became our YAP, our young adult panel.
Just to jump really quick, Lisa, so Ashley, who's one of the Beta Change founders, she just wanted to comment that she loves hearing that more researchers are focusing on young adults and diabetes. Yeah. And I think that's great, because I think that clearly the research and the PhD, community, Ashley's getting her PhD as a dietitian. And, I think that it's really great that there's more awareness about this. And I think that researchers like you who are taking the initiative to get these young adults involved and, come up with your team and your young adult panel, I think that's really important. And it's something that other people are recognizing. So sorry, go ahead.
Yeah, no, I totally agree. It's funnily enough, it's we know loads about children, we know loads about teenagers, we know loads about older adults, but young adults have been really not given special attention. It's a different period of life. There's different stuff going on, and it's really become clear that it's a group that needs to be better understood, so that current problems, current struggles, unnecessary struggles can be properly understood and dealt with better. So yes, I totally agree. A focus on young adults is very, very much at the fore at the moment. There's a lot of groups doing very similar work across different health conditions.
Yeah. So sorry. So once you got your panel.
So yes, with the panel have been very much an integral part. They're co-researchers. They are not participants in the research. They are just as much a part of the research team as the people whose job it is to be on the research team. Their I suppose involvement was very, very core and very much throughout the process of development study. So they were part of what we call the D1 Out development study, and that was completed kind of around this time last year. And the aim of that was to produce a foundation for what is called a complex intervention to improve outcomes for young adults. And what a complex intervention is, it's the type of change or the type of approach to change that you often use in a health setting, because you're talking about the people, so the young adults in this case, sometimes families, sometimes healthcare providers, and the system itself. So you have a lot of moving parts. So it's called a complex intervention because whenever you try to change something, you probably have to change 10 things. So for that reason, because you're talking about so much complexity, it's become the approach to start with this long, and in our case, it was about a 2 or so year development study to figure out exactly what was going on, so that we could suggest a new approach, and we've just started a study to kind of test that new approach that we came up with. But in terms of the young adult panel involvement, following kind of a period of I suppose introduction, getting to know each other, a lot of training. The young adult panel received training led by Jigsaw, our collaborators, in research skills, skills of being on a committee, skills of in relation to sharing, stuff about yourself, stuff about having type 1 diabetes in a group. That's something that people may never have done before. So there was a big emphasis on skills initially, and then a lot of meetings, a lot of discussion of the research as it was progressing. For example, in the qualitative interview study that we did as part of this development study, the young adults themselves, with training and support from a qualitative researcher, came up with the questions that were asked in the interviews. They reviewed what the findings as they were emerging in each of the studies as part of the study, and guided kind of the direction of the research. So there was no part of the research once the young adult panel were on board that they didn't have a real influence and impact in determining and directing. It all culminated then in us having, as you mentioned, the Strength in Numbers conference, which was an event that happened last June.
It was about a year ago, right?
Pardon?
It was about a year ago, right?
Yes, it was just at the end of. It was just now. Yeah, just now last year. So
I remember that.
it was an absolutely amazing experience. The purpose of it was to bring together stakeholders in type 1 diabetes, so young adults and people of a range of ages with type 1 diabetes, people working in services, so dietitians, doctors, nurses. We had researchers, all different types of researchers, in different health and psychology related areas. We had a lot of people from technology, because we really felt like technology was going to play an important role. So we brought these people together so that we could share with them what we found and we could learn from their different experiences. We then presented them with 3 really important areas that we had come up with in our research, and they had to do with how a young adult is introduced to their adult diabetes clinic, the relationship development between young adults and their service providers, and clinic attendance and contact between clinic appointments. They were the 3 areas that were really coming out as important in terms of things that determine whether and to what extent young adults engage in their type 1 diabetes self-management, things that make things easier and more difficult, things that we thought we could possibly influence to better support young adults to achieve their self-management goals. So those 3 things were what you're focusing on. We brought those to this really diverse group of people, and we did what we called a consensus process, or like a group decision-making process.
You were brainstorming, kind of?
Exactly, yeah. A brainstorming process to come up with what is now the D1 Now intervention, which is really a very service-focused intervention. That we're going to over the next couple of years be pilot testing. So we're gonna take it apart, try to figure out how to put the different bits of it into place in health services in Ireland. Pardon?
And roll it out in Ireland eventually.
Yeah, so in stages, we'll first figure out what bits of it, how to do it, what we want to do. So there are different parts of it. For example, having like an online tool to kind of improve a kind of engagement and interaction opportunities. So what will that look like? How will we design it? Does it already exist? Do we have to design it from the beginning? We have to figure out how to put all the bits and pieces of the intervention into place, see whether it works, if people like it, if people don't like it, if it can fit within a busy clinic, with a view in future to rolling out a bigger kind of experiment to fully test this intervention, so that we can say this works, this doesn't work, this part of it does work. We really come up with some hard and fast answers.
Wow, that's so much work, Lisa, and I cannot imagine how much goes into that. And what I'm wondering is, what has surprised you the most when you're doing all this research and you are finding out all these things and you're making all these new discoveries? What have you learned that has really been something you didn't expect?
So many things. Like from the beginning, I had absolutely everything to learn, because I really didn't know a single thing about type 1 diabetes, and that was a huge learning curve, and I'm constantly learning in terms of I suppose the physiology side of it, but also the just a range of experience that people have at different times in their lives, with maybe different lengths of time since they were diagnosed and all that type of thing. I found it really interesting, the experiences that people have, because there aren't that many people or that many young adults with type 1 diabetes. They may never have met someone else with type 1 diabetes, and it was really, really eye-opening to learn from people what that is like. I also have found it really fascinating to learn that so many service providers and young adults have unbelievably similar experiences and insights into each other.
Really?
But still seem to slightly struggle to communicate that, because services are so busy, and there's a certain kind of power dynamic when you're in a health setting.
It gets lost a little bit.
Oh yeah, it gets lost, but it is there, and that's something that we hopefully can bring out.
Wow. Yeah, that stuff that surprises me. I didn't know that.
It's true.
That's incredible.
In my experience, anyway.
Sorry, say it again.
In my experience, anyway.
Well, I think that your experience has definitely been in depth especially regarding diabetes and other chronic conditions. And thank you again for sharing. We're so grateful to have you be our guest tonight and really give us an inside look from a researcher's point of view, because I think that, a lot of people in the diabetes community and other populations that are studied and that are the subjects of research, we don't get to really cross the bridge a lot, right, and talk to our people that are studying this. And I think that's really interesting as a concept, because you can learn so many things from that. We learn from each other.
And hopefully there won't be a bridge to cross anymore. As we go forward in future, we'll all be on the same piece of land. There will be no bridge between researchers and the people that research is for or about. It'll be
And what are some ways, so going along with that, what do you think people with diabetes or any other population, what are some things we can do to support research and be better participants or better help you help us? What do you think? Do you have any ideas about that?
It's a great question, and there's so many answers, and I think the main thing is kind of activity and getting involved. There's so much mutual activity that can happen in terms of researchers getting practice and experience and exposure in terms of doing research that involves this kind of engagement, because a lot of people, we don't have that kind of experience. It's not the way that research has been traditionally done, and it can be daunting and uncertain to jump into the whole area of stakeholder engaged research. So researchers need to jump in there and get that experience and help each other out to figure out how best to do this. And also, people in the diabetes community and all different communities, in across the whole health spectrum, I suppose giving it a try, volunteering, keeping an eye out for things, asking around, and learning from experience what the benefits are for them, and in what way they can contribute. The aim of health research is to make things better and to learn. But it does need to be mutually beneficial because it involves people giving their time. And we're doing some work at the moment with our young adult panel to understand what the impact for the young adults was and is, because the young adult panel are ongoing. What the impact on the researchers who are used to doing research in different ways, what it was like for them to do this. Some of the team are healthcare providers as well as researchers, and what was it like for them, so that we can say why you did this, what impact did it actually have. It's not just a good idea, it's a good idea for these reasons. And it's really bringing out some really interesting things in terms of similarities and differences of the experiences of everyone involved, but also the real benefit that we stand to gain by doing research in this way. And it is hard work, and it's a lot of investment for everyone. So it is important to not just say we should do it, but be able to say we should do it and why. And I really think that social media, and I think you guys are probably very much converted to this, that social media is a great way. That's how we connected. It was a hugely productive way for me to recruit people and to connect with people.
Right.
And so social media, keeping an eye out for activity. For example, our the D1 Now group has a Facebook page and a Twitter feed that's very active. And when we recently recruited some new recruits onto the young adult panel, it was one of the ways that we publicized that was through social media. So that is a great place. And we did something in our team. The Health Behavior Change Research Group is a research group in NUI Galway that I come from, led by Professor Molly Byrne. And we did what's called a research prioritization, where through an online process and an in-person process, we asked people with diabetes, type 1 and type 2, and service providers, policy people, researchers, the whole lot, to literally tell us what were the priorities, what were the main things that we should be looking at under all different headings related to diabetes. And we went through a process of kind of saying, this is what you suggested, what do you think? Do you want to re-rate these suggestions? And we did a couple of rounds of that, and then brought people together in Galway, about 28 people, and continue to go through a discussion process to come up with one priority under different headings for type 1 diabetes and type 2 diabetes, focusing on the person with diabetes themselves, and then focusing on the behaviour of healthcare providers as well. So there are lots of opportunities, and people are getting, very into understanding the experiences of patients or service users or people with different conditions. So I think keeping an eye out, particularly on online, or maybe even in your clinic, wherever it is that you get your care, or maybe in local universities, keeping an eye out for opportunities. But speak up if you have ideas, if you have suggestions. It's going to be a process, and it's all happening, and I think now is the time if people are interested to.
Yeah, I agree, and it's just good to know that our ideas are heard, and that there's people that cares about what we have to say and what our thoughts are and how we want to change our own worlds. It's just knowing that, I think, is a really powerful thing.
When you say that, I completely agree, Katie. And one of the real standout moments at the Strength in Numbers conference last year, a member of our young adult panel, on behalf of the panel, gave one of the presentations at the conference, and her final slide was a kind of a messages from young adults slide. And one of her main messages was about listening and hearing, but also the message that young adults want to change things too. So often young people are kind of, a lot of judgment around, young people are just interested in having fun and, going on trips, and they're not interested in their health, and all of these kinds of assumptions are made. And so it's important for that message to be loud and clear that, if you don't ask, you'll never find out. And young adults very much are interested in their health. They are interested in other things too, but very much are.
We want to get involved, right? And I think, we might not act like it, but we do on some level, I think. Part of it's not having that option, or feeling like we don't have any, feeling like there's no channel for us to make a difference, I think, is a big reason the young adults might seem as if it's not something we're interested in, right? But I think it's like a chicken and the egg thing. We know that there's someone there to listen to that can direct the research, then it might, compel more young adults to raise their hand.
Yeah, I totally agree. That's a great point.
Yeah, that's great. Well, Lisa, thank you again for joining us. I'm so glad to get to talk to you with Beta Change. This is great. And I just really think that, your perspective has been so valuable for the entire diabetes community to hear. So thank you again for sharing with us. And I'd just like to remind everyone that's watching that you can feel free to leave your comments on our video, and Lisa, I'm sure, will be happy to respond to them. And, we would love to have Lisa on again. So if anyone has any more questions, maybe she can be persuaded to come back and do another Minisode with us. But yeah, Lisa, again, thank you so much, and thank you for making the time. We're really lucky to have you on.
Absolutely. Thank you.
Great. Thank you. All right. We'll wrap it up for tonight, but everybody can follow Beta Change on Twitter, and you can like our Facebook page. And don't forget to check out BeLive TV for their awesome Facebook streaming platform. All right. Thank you, everybody. Thanks, Lisa.